the most important problem for Indian healthcare is accessibility. I believe that with Proactiff as a platform, we are trying to minimize that error of accessibility, which will come down to 0%. By this system, we are implementing where we can actually go and record each and every aspect of the human body, depending upon the age, depending upon the risk factors, depending upon the infections or whatever that may be involved in a human system that can lead to death. But all said and done, we have to understand that we are in India where people neglect health. They don't really worry about health or care about health, and they don't like to invest in health. This is one aspect which we have seen. I believe once we are trying to make them wear these wrist watches, it is very important to educate them that because of this modality of these wrist watches, their life could be saved. I would like to ask you, John, how we could educate them and how we could motivate them to wear this kind of a thing, because in India, to implement something is very difficult. For innovation, there is a lot of scope. For ground reality to implement, how are we going to implement this? I think you can.
That's probably the most important question to address in how to improve wellness and prevention, because it is our behaviors, our decisions about what we choose to eat and how much sleep we choose to get and how we manage our stress and how we exercise and how we manage our weight. Those are the things that drive health more than anything. So if we can address those, we'll make a much bigger impact. So how do we do that? There is a very advanced science of motivational science and behavioral economics. This is not unknown territory. It hasn't been applied. So we know that there's a lot of medical science and clinical science that hasn't been applied because there's not enough funding in any country to implement everything we know all of a sudden. But we now have a tremendous amount of motivational science and behavioral economic science that we can begin to apply to know how different people are motivated by different kinds of scenarios and different kinds of tools, and that's something that we've engaged some world experts in motivational science and behavioral economics to help us understand how to personalize. So I like to think of personalized medicine as not just the right medicine for the right person at the right time, but also what is the best behavioral intervention that will motivate an individual to achieve their behavioral goals. And we know that if you just tell someone, stop smoking, stop drinking, exercise more, get your sleep every night, they say, thank you very much, doctor, they go home and nothing changes. We've proven that over and over. So just giving, precisely as you asked the question, just giving more information, just having more science about health does not change people's behavior. We are engaging some motivational behavioral psychologists to help us understand how to figure out for this person, how do we motivate them to change. So I'll give you an example. It's well known that a lot of people that have very poor control of their diabetes, you can tell them a million times, if you don't change this behavior, then you will end up with a heart attack or lose your leg with an amputation, and they won't change their behavior. But what we do know is that different people respond to different interventions. For example, in a software application that helps people keep track of their diet and their exercise and their insulin and their medication and so forth, that some people are motivated very well by humor. That if you make a video that's really funny, they're really motivated by that. Other people say, yeah, I don't, stop playing around with me. This is serious business. So different people respond to different motivational cues. And a lot of the failures in the digital health world of trying to motivate people have come from the fact that they're trying a one-size-fits-all. We're just going to use this one program and give it to everybody. So what we need to do is to be able to motivate those people who respond to humor with humor. Yes. Those people who respond with, you need to do this, we'll give them that. There are other people who want to say, here's your 3 options, and why don't you, let's have a conversation about which option makes sense for you. And there are other people still who want to take it back and talk to their family and have a discussion with their household about what works for them. And so we're bringing in, we're talking to them right now, some people who are expert at quickly identifying what is the most effective way. Not only what is the best way to motivate people, but also how often and in what sequence do you send an email or a text message. And now everybody's, not everybody, but most people have cell phones, and even in the most rural parts of the country, there's a cell phone. So we can give out, software applications that cost very little, but we need to know what kind of motivational tools, in what sequence, in what frequency motivate different people. And there's a lot of research that's being done in that space right now to help us quickly identify, for this person, this is the motivational profile. So I've invented a term for this. And I like to think of a motivational formulary just like a drug formulary. So these are the best medications for you. These are the best motivational tools for you. And it may be different for your husband or your sister or your mother. For the same disease, we may use a different approach. So bringing together the best of motivational science and behavioral science and bringing that to personalize it, that's where the real change is going to happen. We cannot continue, there's an old saying that doing the same thing over and over and expecting a different result is the definition of insanity. We know that just telling people stop smoking, stop drinking, eat healthy, and sleep healthy, it doesn't work. We need to do something different, and that's your question. How do we motivate people? And we need to personalize it.
I think there's going to be a great sort of advantage for us for Proactiff in that these diagnostic tools and whatnot will be in hospitals and with doctors and whatnot. So there's going to be sort of a proof of use and an efficacy, demonstratable. But then we'll also be out in small kiosks and areas in rural areas where we can make it more of an app-driven or a visit this kiosk and go see what your health looks like. Go have a little fun today, and this afternoon you're going to go for an hour. You're going to go into this digital, diagnostic center. You're going to take 2 or 3 different tests. We're going to tell you a little bit about yourself. It's going to be fairly inexpensive, and we can, help you along the path, along the way. And I'm not sure. I think as our success story grows, or as we build a success story, that we'll be able to get more people, also hopefully in government and in the administrative groups in the hospitals and whatnot, involved in this sort of rural system. So it's almost like a feeder system where you can go out into these rural areas, say, here, have a little fun with this. Wear this for, half a day and come back, and we're going to tell you all about what's happened to you today. And, let's take this test, this little test about diabetes, just so we're sure that, nothing is going on. And make it something where it's inobtrusive, it's kind of fun, it's different for them, versus something where if we're in an ICU unit, it's on and it's there and it's attached to alarms, and it's all of these things that hospitals really need in a much more serious way. So the combination of the two, I think, would be highly motivating.
I believe that John and Andrew and Ramesh, the most important thing we would benefit out of this platform is for hospitals in India or healthcare facilitators. The most important problem we face today is our patient comes very bad to the hospital. We treat him well, patient becomes very fine, patient becomes very healthy, and then we discharge him. And after discharge, we don't know what is happening to the patient. See, when you join the hospital, your blood pressure might be 200.
I would like to add you further, please go ahead.
200. And then when we treat you, your blood pressure comes back to 130, 120, and then you get discharged. I'm just giving a small example. Right. When you go back home, after 2 to 3 days, and you start forgetting your medicines, or you don't maintain the correct instructions that are followed by your general physician, and whatever prescribed has not been done, your BP shoots up to 200 again. So I believe for healthcare facilitators, for doctors like us, this is a great platform to keep a track on our patients, not only when they are with us, but when they are anywhere in the world.
Exactly.
Yeah.
So this is a very good initiative that we are taking.
And the
And
time
that,
bomb.
let me just say that that's why Kamesh brought Andrew and I here to the Winn Hospital, is because whenever you're really changing something in a big way, you must have visionaries who understand why it is we're doing this, how it works, and how this is, we're gonna have to learn as we go and develop it out. So we're here because we have a visionary
Yes.
who sees how to do this. And what we would like to do over time is as we prove this out and as we get more and more patients involved, we're looking for other visionaries who, like the CEO of this hospital,
Dr. Vinay.
Dr. Vinay, is a visionary in this. We're looking for more visionaries as we grow this out to be able to bring this everywhere, not just in India, but across the world. So this is why we're here today.
Lastly, I would like to add, not only the hospitals, we talked at length on the hospital, but having the preventiveness would warrant having the digital diagnostics labs and centers spread across the rural India, because today you have tremendous urban concentration, and today we have with us also Mr. Serial Entrepreneur Srikanth Maidam, who is establishing about 10 of the digital diagnostic centers in the labs in the city to begin with. And that's a quite an extraordinary thing. Now there is a tacit collaboration between the digital diagnostic center, so everything looks okay. You go home, you have the perpetual health record updated like your Gmail, happy. But if there is any issue that needs to go out to the doctor, the hospital, the nearest hospital, that is the collaboration what we are having. And fortunately, we have the partnership with, for example, Vinn Hospital in Hyderabad and the nearby locations. Likewise, in Madhya Pradesh, we have.
I've just decided yesterday
Please.
that we
Yeah.
should not only implement this in our facility in Hyderabad, but it is a good news that we are also going to implement it in Kathmandu in Nepal.
Wonderful, that's a unique gesture as we see, right in Nepal and Kathmandu, going into different countries is a fantastic thing. And just as to give you a visual example, we have even Dr. Tiwari who runs the National Hospital in Bhopal, and they take care of the cardio type of issues, and they are very focused in the specialization and the cardiodiabetology, the renal function, CKD type of issues. That said, we have Mr. Anil Kandija, who is running several of these digital diagnostic centers in Madhya Pradesh state and Bhopal, Indore, Gwalior, etc. Different partners are coming through. Now this cohesiveness of bonding, not the post payment, sorry, you can quote me, I can take the bashing, how to get rid of this with the transparency. Because now we are monitoring in real time whether BP is up or down and the alert notification goes to the doctor, there is a transparency and accountability. So what gets otherwise in different other post payment is altogether eliminated with this technology element. Only the genuine guys at that time, even the patient can see, oh, this is way too high, risk factor, I need to go to the hospital. That end-to-end tie-up, taking the diagnostics and packaging with the integrated model to the hospitals is the way to go. And maybe I appreciate if we could do the same thing in Kathmandu too.
Yes.
Because that really shows the value for the customer or the patient that we care for you.
Yes.
And that message, most of them have the pretension, I could say, at best case, because it's anyway reactive. So you have good luck, then you prevail. Otherwise, by default, you sign a document where there are no guarantees, right? So that itself a liability clearance. I'm not pointing fingers, but that's the risk call out I'm making. But anyway, with this, to quickly summarize, any quick summary thoughts for 30 seconds, 1 minute, please go after.
I'll just say that if this sounds too good to be true, it's not. We've already done a lot of this work in the United States and other countries are doing the same kind of work, the Netherlands, the UK, and we're seeing early results. So this is not a dream. We're in the ground floor of a real tsunami, a real change that's coming into healthcare across the globe. And with local visionaries here, we're going to be able to make this happen. It's going to
I
happen.
just want to add.
Andrew,
I would
quick
just
thoughts
say
and
that
then we'll come to the topic.
another thing that's a point of optimism is this is not something that is years away or even months away. This is weeks away from launch and implementation in India and here at Vinn, some other areas around locally and whatnot. So it's an exciting time, and I'm glad to be part of it.
Doctor.
I would just like to add, as being a doctor and a radiologist and MD, CEO of Vinn Hospital. We are going to be the first to create something in healthcare for the future. This is going to be the next future of healthcare. This is what is going to drive all of us forward with the energy and the enthusiasm to not only do something as a business, but to do something for a lot of people who are not accessible, who are deprived of healthcare in this country. So I'm really happy to be associated
Yeah.
with this.
Definitely, we look for active collaborations. Finally, we have the director of the Vinn facility here also. Would like to have quick words from you as well.
Can I
Please.
speak in Telugu?
Absolutely.
Yes.
చెప్పండి తెలుగులో కూడా.
యాక్చువల్లీ ఇప్పుడు ఈ ప్రోయాక్టివ్ వాచ్ అనేది ఉంది కదా,
చెప్పండి.
అంటే దీన్ని రూరల్ ఏరియాకి అని,
అవును.
అంటే ఎవరికైతే నీడీ ఉన్నారో
అవును.
హెల్త్ ప్రివెంటివ్ దాన్ హెల్త్ అంటారు. మనం ముందు డిసీజ్ ని కనుక్కోవడం చాలా ముఖ్యం
Correct.
కాబట్టి
Early stage
ఎర్లీ స్టేజ్
detection.
లో వాళ్ళకి డబ్బులు కానీ లేకపోతే ఫైనాన్షియల్ అసిస్టెన్స్ కానీ ఉండేవి కాబట్టి ఇక్కడ కూడా మన గవర్నమెంట్ స్టేట్ గవర్నమెంట్ కూడా బాగా ముందుకు వస్తుంది. దాన్ని మనం టైఅప్ కూడా చేయొచ్చు స్టేట్ గవర్నమెంట్ కూడా, ఎందుకంటే కనెక్షన్స్ ఉన్నాయి వినాయక్ గారికి.
చాలా
మన స్టేట్ గవర్నమెంట్ సీఎం గారితో కూడా మనం మాట్లాడవచ్చు.
అదే మీ రాజీవ్ ఆరోగ్యశ్రీ
ఆరోగ్యశ్రీ అని ఒక
పథకాలు
ఆరోగ్యశ్రీ
ఏవైతే ఉన్నాయో
దాంట్లో కూడా మనం tie up
అనుబంధం
చేసి
చేయొచ్చు.
we can make an state